let's take a look at normal white blood cell numbers and how they might appear on a lab report. One of the tests performed is a total white blood cell count, which typically falls between 4,500 and 11,000 WBCs per microliter of blood. This number gives doctors a quick snapshot of how the immune system is doing, whether it's fighting off an infection, responding to stress, or dealing with another underlying issue. A count outside this range doesn't always mean something serious, but it's a clue that might lead to further testing. A white blood cell count with a differential breaks down the different types of WBCs. The percentages of white blood cells in a differential count are based on the total white blood cell count. Instead of looking at just the overall number of white blood cells, a differential breaks down what percentage of that total is made up of each type. Neutrophils, 55% to 70%. Lymphocytes, 20% to 40%. Monocytes, 2% to 8%. Eosinophils, 1% to 4%. Basophils, less than 1%. A handy way to remember these from most to least numerous is the mnemonic "Never Let My Engine Blow," standing for neutrophils, lymphocytes, monocytes, eosinophils, and basophils. Knowing the normal values of white blood cell counts can help us monitor patient health.